But for those who don't have health insurance, and for the cost of health care, we need to address what's wrong with our health care system. And that the first thing that needs to be fixed is what Dr. Dukes pointed out, the 46 million who have no health insurance in America. That's a large number. It's an expensive number for us in this country because we pay for that health care, we just don't pay for it in the most cost-effective way. So in all the bills that are moving forward, there are three major provisions. Individual responsibility. Every person in this country will have to have health insurance. You need liability insurance if you're going to drive a car, and you're going to have health insurance. Individual responsibility. There's employer responsibility. Employers are expected to cover their employees with health insurance. Now, for large companies, that is the norm. For smaller companies, many do not. There will be special provisions in here for small companies. Some small companies will not be required because of the size and number of employees. There's major differences between the House and Senate bill as to what a company needs to do. Either if you have adequate coverage, that's one thing, but if you don't, can you pay a sum of money in lieu of insurance? The Senate committee says you can pay $750 a year. The House committee says 8% of payroll. So these are major differences, but there is employer responsibility that you must contribute to the health care needs of your employees. And then there's government responsibility. The government will help subsidize lower income wage earners. The government will help provide incentives for employers to provide health benefits for their employees. So it's shared responsibility, individual, employer, and government. It builds on the current system but tries to reduce cost. How? Well, first, universal coverage will help bring down the cost of health care. Now, I want to differentiate, if I might, between what the taxpayers of this country are paying for health care, what government budgets are for health care, and what the total health care budget of the country is. What we need to do is bring down the growth rate of the overall health care cost of America. We cannot sustain how much money we are spending and projected to spend in health care. It is twice as much as the next most expensive country in the world on a per capita basis. We don't have the results to justify that type of expenditure. So we need to bring down the overall growth rate of health care costs in America. That's a prime objective of our bill. Now, how do we go about doing it? Well, universal coverage will help. Less people will use emergency rooms for primary care if they have health insurance. We know that. We'll get earlier detection of diseases. If people have health insurance and they are not faced with the personal dilemma, how am I going to pay for this bill? You know, we have families today who have to make terrible decisions as to whether their child is sick enough or their injury is serious enough to go to a doctor because they don't have insurance. And they know if they go to the emergency room, it's going to cost hundreds of dollars. So what we're trying to do with universal coverage is provide adequate care, affordable care, quality care to every person in this country. The President feels very strongly, and all the bills that are moving through Congress place a very high priority on prevention. Prevention brings down cost. The screening tests cost hundreds of dollars and can literally prevent certain diseases. The failure to detect a disease at an early stage may very well require very costly surgery, which can cost tens of thousands of dollars. Prevention saves money, it saves lives. So the President invests a significant amount of money, as do the bills that are working through Congress. Things such as school-based health facilities, workforce issues, so we have more health care professionals trained in primary care, in community health, so we have a better workforce to deal with preventive care in America. There's a significant investment in health information technology. I've already explained that not only is important to cut down the administrative burden on the billing system, but also to share information. I was in Anne Arundel County not too long ago talking to people in the emergency rooms who weren't able to get information from the doctor's offices located across the street. So if you went in for chest pains and your cardiologist had the information, the emergency room didn't even have that information. So it's that type of sharing of medical information which can bring down the cost of health care. Another common ingredient that's included in most of the bills that are moving forward is the regulation of the health insurance marketplace. Now, the federal government traditionally has been hands-off here. It's been traditionally a state responsibility. But now the federal government is saying, we're going to make sure everybody has affordable quality health insurance. We have to set the parameters. So what do we mean by that? Well, there will be community rating. You will not be able to say to someone you can't join a health plan because of pre-existing condition. You're not going to be able to rate a company based upon the experiences of its employees. You're going to have to do community rating. So you're not penalized if you're a small company and you happen to have one person whose spouse perhaps needs an open heart surgery, as you are today, will be community rated, so that it'll be a more affordable, predictable cost for the individual and for the company. We will start to look at and regulate loss ratios so that we know that a certain amount of your premiums return to you in benefits. We will start to eliminate caps. Caps make no sense. The more you need, your insurance should be there. So we start to eliminate caps, and we start to develop guaranteed benefit packages so that the type of health care services that you need to stay healthy will be covered by your insurance plans. Now, there are many issues that are not yet resolved, and I want to make it clear. There's a lot of controversial issues in where we're heading, and I don't know where we're going to end up here. And I hope this discussion today will help me at least try to formulate where I think we should try to aim in resolving these issues. Let me just mention a few. The employer mandate is far from resolved. There's a lot of concern about the burdens that could place on employers, the subsidies that we provide for affordable health care, the public insurance option. I don't think there's been an issue more misunderstood than the public insurance option. So let me try to explain this. There's been some who say that there's an effort to socialize medicine. That's not true. Doctors are going to be private. Hospitals are going to be private. If you happen to be in Medicare, you choose your doctor, you choose your hospital, you choose the care that you want, even though that's a public insurance option. And quite frankly, I haven't heard many of those who are saying we're against the public insurance option suggesting that we repeal Medicare. Because Medicare has been a very cost-effective insurance program over many years. So public insurance just means how do we go about collecting the premiums and paying the doctors. It has nothing to do about how your care is provided and your choice. We want to preserve choice. We want decisions made by doctors and patients. And we're going to preserve that under any of the options. But one of the reasons why we want a public insurance option is to keep costs down. There is no public insurance option for Medicare Part D. It's only private insurance. And we have overpaid, that's you, taxpayers of this country, have overpaid because there is no public insurance option. Let me give you one more example. We have a private insurance option under Medicare Advantage, where you can select a private insurance company to cover you under Medicare. Now, every senior who enrolls in Medicare Advantage costs the taxpayers of this country a little bit more money because the public insurance option is less expensive than the private insurance option. What we're trying to do is get the cost down. We want to keep the private insurance companies honest in the way they build their product. And that's the reason we need a public insurance option, to keep the cost down. Look, the surveys show, and they've done this, that if we include a public insurance option, most of the people, almost all, that currently enrolled in private insurance are going to remain there. We're not trying to get people to leave their private insurance. We're just concerned when you have people that live in remote areas, people who have to get an individual insurance product, they're not part of an employer group, that they're going to have a hard time finding an affordable private insurance option. We just want to make sure there's a plan available. And this is one of the debates in Congress. What do we do about it? So one of the compromises that's been suggested is, why don't we have a co-op? Now, I'm not exactly sure what that means. I'm really not that sure what it means. We had one. It was called Blue